Snow White is one of our lovely elderly residents here at Redwings. She is a 26-year-old miniature Shetland, and she's been here at Redwings as a resident since 2008 when she was rescued as part of a really large welfare case. She is an absolute favourite amongst all of the hospital yard and veterinary team staff. That's probably because we see her quite frequently because she has quite a few ailments, but she's also just a really lovely little pony. She's very easy to handle. She's also a really great example of looking after an elderly horse and the special measures that you need to do to make sure that she's well looked after here at Redwings. So after being here a couple of years, Snow White had really quite a nasty corneal laceration on her left eye. The injury recovered really quite well, but she does have quite a lot of scarring now on that left eye. So she has slightly reduced vision in that eye, and we have to be a little bit careful if we're around her left side because she can't always see us that well on the left-hand side. We just have to let her know that we're there and that we're doing stuff on that side just so that she's not scared if she can't see us brilliantly. In 2020, she also had surgery on her right eye to remove a little melanoma. And because of that, the eyelid margin is not a completely normal shape anymore. And so she's a little bit at risk of getting dry eye in her right eye. So again, she has twice daily medication to that right eye just to make sure that it stays nice and lubricated and she doesn't get any problems with dry eye in that right eye. On top of those two conditions that we sort of manage all the time, Snow White also is PPID positive, as lots of older horses are, and she also has insulin dysregulation. And those two conditions make her a lot more at risk of getting laminitis. And unfortunately at the moment she is staying in the hospital because she's currently having a little episode of laminitis, but she is doing quite well. She's quite comfortable at the moment, so that's really good. But because of her laminitis, and problems like that, the PPID and the insulin dysregulation, she's actually on permanent medication to help manage those conditions. So again, we have to give her medication every day. Because she's so tiny, because she's a miniature Shetland, her little hooves are really, really small, and it's very difficult for the farriers here to actually nail shoes onto her feet just because they're so tiny and the nails don't really come that small. So as you can see outside her stable, she has a lovely little pair of pink special sparkly boots that she can put on her, well, she doesn't put them on, we put on her feet, and she wears those if she needs to move around the sanctuary on hard or stony ground or anywhere that she might find uncomfortable. Along with those things, Snow White also, being a more senior lady, has quite regular dentalling here at Redwings. So she's seen every 6 months for her routine dentistry. And actually for a miniature Shetland and for her age, she does have a really good mouth, but she does have a couple of problems in there, particularly diastema, which are sort of small gaps between the teeth that food can get stuck in and become lodged and then provide a site where bacteria can sort of congregate and cause more problems. So we dental her 6 monthly just to make sure that they're flushed clear and they're not causing problems and things aren't deteriorating. But we can also check in her stable while she's stabled for signs, even when she's out in the field, for signs that there's problems with her mouths, for things such as quidding or her difficulty chewing or getting food pockets on her cheeks or anything like that. So again, that's another sort of form of special care that Snow White gets here and allows us to interact with her really quite regularly and means that we get to spend lots of time with her, and we all like that because she's such a favourite.